Treatment of bleeding associated with warfarin. With warfarin overdose, we treat bleeding according to the INR. The INR of the patient is between 5 and 8, and there is no serious bleeding. Here we no need for any treatment, but we have to check INR daily and look for other causes of bleeding, such as other drugs or alcohol. If the INR of the patient is more than 8 but there is no major bleeding, we can start with vitamin K 2 milligram if INR less than 12, or 5 milligram if INR more than 12. We have to stop warfarin and reintroduce warfarin if INR less than 5. In case of INR more than 8 and major bleeding, we can start with fresh frozen plasma 2 to 4 units plus vitamin K 2 to 4 milligram, and look and treat other causes. And in case of life-threatening bleeding, such as intracerebral bleeding or eye bleeding or severe cases, we can start with prothrombin complexes. For heparin bleeding, all what we need is to stop the heparin, and the INR will normalize after 3 to 4 hours only. Sometimes we can use protamine sulfate 1 milligram IV. In the case of low molecular weight heparin, there are fewer side effects. For a case of fibrinolytic bleeding, we can use supportive treatment only, and sometimes we use cryoprecipitate or aprotinine, which is tranexamic acid alternatively. And in case of liver disease or chronic liver disease bleeding, here we may use vitamin K, but high dose 10 milligram IV slowly, or fresh frozen plasma, or sometimes we use prothrombin complex if life-threatening bleeding. And last thing, the renal failure bleeding, here we can use dialysis or cryoprecipitate or DDAVP or epopoietin. Thank you.